Welcome to Knowledge Chat channel. Today in this video we will be discussing about the continuation of the previous videos. As I've already told that we are into the discussion of Six Sigma concept. So how we can apply the DMAIC framework in order to reduce the patient wait times using the Six Sigma concept. As you all know that this Six Sigma has been implemented in most of the industries nowadays, all the MNC companies, and there are many certifications related to this which we have discussed in the previous videos. And now, if you are really interested with the introduction and other things, you can just go back and watch and come back to this video. So now here we will be discussing about, so what do you mean by? So already I just want to have a small quick recap. So we have discussed about the need, we have discussed about the applications, and we also given a small introduction of ED crisis, what are the different challenges that are faced by the patients, and what is the patient, how, because nowadays patient volumes have been increased enormously, and the wait times and patient safety is the need of our today. So, in order to achieve that, how we can use this DMAIC framework? DMAIC framework is nothing but the Six Sigma, that is define, measure, analyze, improve, and control. So, this is the framework which is used in the Six Sigma, and Six Sigma has been applied in almost all the MNC companies like Microsoft, Google, Amazon, everywhere. Okay. So, I have given a small introduction in the previous videos. So, now let's move on. So, in this video, I will be just giving you something. The content overview will be like I will be just telling you because we have discussed about the introduction. I will be discussing again with the DMAIC concept. I think we have discussed about two different topics in DMAIC previously, that is how to identify the bottleneck as well as what is the baseline data collection what we are doing. And in this video we will be discussing about the root cause identification as well as the how the solutions are being implemented. So this is what we are going to discuss. So root cause identification is nothing but the analyze phase of the DMAIC architecture. So during the analyze phase, the team uses the statistical tools in order to determine why it has occurred. That's a very important question. Why? Because the why it has occurred, if we are able to identify, it's a very important thing, and we can identify and we can proceed. So here we will be using a diagram called as fishbone diagram. It is called as fishbone diagram, and this is often employed in order to categorize the causes into themes like staffing, equipment, or procedures, or whatever may be. So this fishbone diagram is a very important concept. And now this analyze might reveal that the primary bottleneck isn't the number of doctors, but rather than slow turnaround time for the laboratory, which has resulted or lack of available inpatient beds for the admissions. So this is the outcome of this particular analyze method. Okay, so I just repeat. So this analyze, it has revealed that the primary bottleneck is not because of the number of doctors. It is because of slow turnaround time from the laboratory, which has resulted in the lack of available of the inpatient beds for the admissions. And the next one is implementing the solution. So how to improve? So implementation solutions, but how to improve? This is the last phase, the last before stage. That is how to improve. So in order to improve the phase where the team tests and implements changes based on the data findings. Okay, so this is the improve phase. See, for example, you can see that there may be some common interventions in the ED, which may include like fast track lanes for low acuity patients, for example level 4 and level 5, to keep them from clogging or something like that, or main treatments areas or something like that. So like other improvements might also involve like bedside registrations, optimizing the nurse to the patient ratios during the peak hours. So these are all the identified and which are identified in the measure phase, and that has to be implemented to improve, and that has to be implemented in the improve phase. So hope you're clear with what we have discussed. Okay, and so we have discussed about all the different things, that is DMAIC, and the next phase we'll be discussing about the sustaining the gains. So that is nothing but the control phase. So I will be just giving you a glimpse of what we are going to do in the control phase, that is sustaining gains. Okay, So in order to close this session, I just want to convey again the need. What is the need for the Six Sigma? So you know that what is the need, okay? So the need for Six Sigma is nothing but, that is it is using the quality control tool, and it is using the data driven philosophy, and it is used by world's largest organization in order to achieve the near perfection. For any MBA student, this is a very important concept, okay? So the need for Six Sigma is nothing but, or the primary goal of Six Sigma is nothing but, in order to achieve the level of quality where the process produces not more than 3.4 defects per million opportunities, DPMO. 3.4 defects per million opportunities, DP 3.4, only 3, it should be less than 3.4 DPMO. That is called as Six Sigma. Okay, that is called as Six Sigma. If you are not clear, please watch the previous videos and come back. So this is done in order to minimize the variation, which ensures that every product is consistent, and it by reducing the surprises for the customer. It increases the profitability, it increases the decision making skills, and it also improves the customer loyalty. As you all know, already we have discussed that this particular Six Sigma concept has been used in many of the prominent MNCs like Amazon, Microsoft, and Caterpillar, Toyota, Samsung, Intel, so many. Okay, and anyway, I will just stop with this session. So there are many job opportunities also which has been discussed in the previous session. If you're really interested, you can just watch the previous session and come back. So with this, I will just close this session. I hope you're clear of what I'm trying to tell. Okay. So thank you very much for your patient listening, and if you really like this video, please give a thumbs up, and if you have any doubts, you can just comment, and if you really feel that this particular video will be useful to someone, please share it, and if you really like the videos which I post on this channel, please subscribe and give me a support. Thank you.